Hi, Mrs. Johnson. We have the test results back from your prenatal blood tests. The test results show that there are abnormal quantities of different proteins and hormones in your blood. These levels, along with your current age of 39, indicate that your child may be at an increased risk for having Down syndrome. The test is not able to be used to make a definitive diagnosis, but it does indicate that there is a high likelihood of your child developing Down syndrome. In order to diagnose further, we can complete a diagnostic test known as a percutaneous umbilical cord blood sampling, also known as PUBS. The test is normally done after patients are at least 17 weeks. Because you are 19 weeks pregnant today, we can perform the test on you. During the testing, we would be taking a sample of blood from the umbilical cord and using an ultrasound as a guide during the procedure. The blood would then be tested for the presence of an extra chromosome pair. This test is the most accurate at this stage in your pregnancy. So, a little bit more in detail about Down syndrome. There's 3 different types of chromosomal abnormalities. So, in Down syndrome, chromosome 21 has an extra partial or full set. And the most common form of Down syndrome is trisomy 21, which is non-disjunction, and it accounts for about 95% of the cases. Translocation is another type of Down syndrome, and it accounts for about 4%. And mosaicism is another type that accounts for about 1%.
So, just to give you a little bit more information about this genetic condition, some of the more common physical findings after the child is born include having a small head, a flat nose, upward slanting eyelids, a small mouth, small ears, excessive skin at the neck, a single palmar crease of the hand, and a short fifth finger with wide spacing. Oftentimes, there can also be cognitive impairment ranging from mild to severe. The severe end of the spectrum is more rare. The most common medical manifestations of Down syndrome include congenital heart defects, and this can happen in about 50% of the babies born with this disease. So this would be important to be doing prenatal cardiac testing so that the physician can be prepared to take care of whatever deformities that may be present when your child is born in their heart. Other commonly associated conditions include having hearing loss, obstructive sleep apnea, ear infection, cataracts, vision problems, needing glasses later on, intestinal blockages at birth, hip dislocation, thyroid disease, anemia, leukemia, and oftentimes older adults with Down syndrome are at higher risk of developing Alzheimer's. And as of 2007, the average age of survival for those with Down syndrome is 47 years old. So Down syndrome is actually the most commonly occurring chromosomal condition, and approximately 1 in 700 babies in the United States is born with Down syndrome, about 6,000 each year. And older mothers over the age of 35 are generally at increased risk of having a child with Down syndrome. So, to give you more information about this condition and other resources, I have a website for you called the National Down Syndrome Society, and they have many support groups located throughout the United States. They have over 375 affiliates, and there's a wide range of support that's available through these groups, ranging from parent, sibling, and grandparent support. The website itself has a wide variety of information about Down syndrome, and they would be able to answer many questions that you may come across. And this is a great way to learn more about the syndrome and learn from others in similar situations. So you are not alone in this, and we can help you find more information. So at the end of this visit, we're going to be providing that website to you.
All right, and here's a brochure with a little bit more information about Down syndrome. So if you have any questions, just come back and we'll talk to you more about this, okay?
Thank you.